I'm Maryellen King, and I am the VP of Clinical Operations at Cardiac RMS. I am a nurse practitioner with experience in cardiac device monitoring. Prior to becoming a nurse practitioner, I was a heart failure nurse and a certified case management, working in a very innovative heart failure program that allowed me to see patients in the hospital, in nursing homes, in their homes, and used telehealth technology, such as it was at the time. One of the services that we provide at Cardiac RMS is RPM, or Remote Physiologic Monitoring. RPM is interesting. It is a way for patients to send blood pressures and weights and pulse oximetry data to a provider on a daily basis. And that's wonderful. Very useful in making clinical decisions, but a lot of data to manage. The data comes in and it's just an overwhelming amount of information. One of the solutions that we have come up with is to layer or add principal care management to our RPM services. And principal care management is not well known. Principal care management was developed in 2020 and is geared to fill the gap left by CCM and is aimed specifically at specialists who are providing care for a single serious disease condition that will last at least 3 months, maybe a lifetime, that is associated with high risk of hospitalization, with decompensation, with functional decline. And it allows a provider to focus in on that specialty care. It requires 30 minutes of clinical staff time, as well as a comprehensive single disease care management plan. And we are able to provide that. We have registered nurses who are experienced in chronic conditions such as heart failure and hypertension, and they are able to perform these care management services. They also utilize the RPM data. So now a patient is sending weights and blood pressures. A nurse care manager is looking at it, is interacting with the patient, developing that relationship, understands the meds, and can utilize standing orders to help a patient titrate up a medication or add an extra dose if something is needed. The patient has access to someone they can call instead of the office who knows them well. And the nurse who is involved with the patient understands when to escalate an issue or concern to the office and becomes integral to the clinical team providing care for that patient. There are a lot of reasons this works well. This takes the burden of patient phone calls and direct daily management out of the hands of the physicians and the clinical staff, and allows us as a partner and a dedicated care team to assist in that management. So patients can call us and we can help that day-to-day volume. We're able to provide all the documentation that's needed and keep you and your staff up to date on what's going on with your patients, and it's reimbursable. So why should you choose Cardiac RMS when you have the wealth of other options out there? Cardiac RMS is one of the only companies to have a long and successful track record in managing a large volume of remote patients, and we have developed best practices over time and continue to refine them. We are not a software company who provides some service. We are a service company who utilizes the best software out there. And we have a strong history of providing long-term relationships with physicians and practices. We're innovative, we're flexible, we use groundbreaking technology, and it really is exciting to provide patient care where the patient is at, in their home, and not in acute care setting. I could rave about our team. I am very proud of our clinical team. They are excellent. We hire staff and we seek out people who value clinical excellence, who value doing the right thing and for putting patients first. And our staff are dedicated to specific clinics. Continuity of care is just so important. And this allows our staff to develop relationships with patients, with the clinical team, with the providers, and that just pays off so much in the long run. And yes, we are a team of healthcare providers, and like you, we want to get reimbursed for the work we do. So we're very careful to be compliant with all the regulations and the rules. We're very diligent about providing the documentation. However, our goal is to provide high quality care, always as our first focus. I hope I've intrigued you. I hope you have some questions. If you're interested in working with a long-term partner in providing high quality care to your patients, if you're interested in a consistent and dedicated team of clinicians who are going to put your patients first, give us a call. Our number for Cardiac RMS is 1-844-438-2767, or you can look us up online at cardiacrms.com.